Has anyone else noticed that reports of heart attacks and strokes have suddenly become more frequent lately? In 2023, a man in his 20s while on the toilet suffered a sudden fatal heart attack. In 2024, a 29-year-old guy had a sudden myocardial infarction after getting enraged from an argument with a coworker. In 2025, 35-year-old singer Pu Jiang and Zhao Han, founder of For the Ocean, both due to heart attacks, passed away suddenly. If you've also ever felt emotionally agitated during intense exercise or while pulling an all-nighter and experienced chest tightness, chest pain, or shortness of breath, please type "I have" in the comments. Don't just think you can tough it out and it'll pass. You might just kick the bucket. In this video, we're going to explore the causes of heart attacks, the warning signs before an attack, and preventative and remedial measures. This has all been repeatedly reviewed by cardiologists and neurologists. We hope that at a critical moment this knowledge can be your lifesaver. But more importantly, we hope everyone can take preventative measures in advance to keep the risk far, far away. Our heart beats around 100,000 times a day, pumping about 8,000 liters of blood. The blood it pumps in a lifetime could fill 100 standard swimming pools. It's so powerful, so resilient, that we all mistakenly believe it will never fail. Until one ordinary day you're doing some ordinary thing. Maybe you just ate a big meal. Maybe you got really angry. Maybe you were straining on the toilet. Or maybe it was just because the weather suddenly turned cold. Suddenly you feel a crushing pain in your heart as if it's being squeezed tightly in a fist. The pain isn't like a cut from a knife or a prick from a needle, but rather a pressing, suffocating tightness and constriction, which can radiate to your left arm, left shoulder, neck, or jaw. At this point, you are very likely experiencing angina. If you experience the symptoms above, and they last for more than 15 to 20 minutes, and it doesn't get better with rest or nitroglycerin, then it's highly likely you're having a heart attack. At this point, do not under any circumstances move around randomly. And don't even think about calling a cab or driving yourself to the hospital. Please call 112 immediately, right now, instantly. Do not delay your chance for treatment. Here's another thing, a set of CPR procedures. If you have someone with you, you can screenshot this and send it to them. If cardiac arrest does occur, this might give them a fighting chance to survive. The bad news is that necrotic myocardial cells currently cannot be regenerated. The even worse news is a significant number of patients with silent heart attacks don't present with typical symptoms. This is especially true for the elderly and diabetic patients, who might only show symptoms like nausea, dizziness, or even a toothache, which are easily ignored. So why do we get heart attacks? A heart attack, in many cases, isn't some sudden random accident. It's the culmination of decades of buildup. The main culprit behind the scenes is coronary heart disease, or more formally, coronary atherosclerotic heart disease. Our heart is responsible for pumping blood to the entire body, and the coronary arteries are responsible for supplying blood to the heart itself. Atherosclerosis of the coronary arteries happens when yellowish oatmeal-like fatty deposits build up inside the lining of these arteries, forming plaque. This leads to the narrowing or blockage of the coronary arteries, causing the heart muscle to be deprived of blood and oxygen. The typical symptom for most cases of coronary heart disease is also chest pain, but it's usually not as intense as a heart attack, and it doesn't last as long. It can usually be relieved with rest or medication. So how does atherosclerosis form? The inner lining of a normal blood vessel is smooth and tight, making it hard for lipids and other impurities to get in. But as we age, our blood vessels gradually get older too. At the same time, factors like high blood pressure, high cholesterol, diabetes, and smoking all damage the endothelial cells, causing injury to the inner lining of the blood vessel. This is the very first step in causing atherosclerosis. When the inner lining of your blood vessels is damaged, lipids like low-density lipoprotein cholesterol will seize the opportunity to accumulate on the inner wall of the vessel. Bit by bit, it all adds up, forming plaques one by one, which gradually lay siege to the heart. Some of these plaques have less lipid and are thick with fiber, making them solid and stable like a hard biscuit. Others are full of lipids with a thin fibrous cap like a fragile pouch ready to burst. Once a plaque ruptures and forms a blood clot, completely blocking the blood vessel, it can lead to a heart attack, a stroke, or other catastrophic consequences. Strokes and coronary heart disease, which are primarily caused by atherosclerosis, consistently rank among the top 3 deadliest diseases worldwide. The number of deaths caused by these conditions each year is about 18 million. It's safe to say that's pretty terrifying. So how can we reduce these ticking time bombs buried in our blood vessels? High blood pressure, diabetes, as well as obesity, and the damage from smoking? We've already covered the prevention of these before. If you're interested, you can go back and check out that video. In this episode, we're going to talk about one of the most important risk factors for atherosclerosis, high blood lipids. Dyslipidemia, as the name suggests, means that one or more types of lipids in your blood are at abnormal levels. This includes total cholesterol, triglycerides, low-density lipoprotein cholesterol, and so on. Low-density lipoprotein is the main culprit that seeps into the inner arterial wall and continuously stirs up trouble in there. Furthermore, abnormal blood lipid levels are also closely linked to the onset and progression of high blood pressure and diabetes. These three are like a gang of villains working together, increasing the risk of developing atherosclerosis. So the dangers of abnormal blood lipid levels are not to be taken lightly. In the 20th century, the age-standardized death rate from coronary heart disease in the United States reached a turning point in 1968 and began to decline. From 1980 to 2000, it dropped by over 40%. Of that controlling risk, factors contributed 44%. The biggest contribution came from the reduction in total cholesterol levels, which accounted for 24%. Unfortunately, however, the prevalence of dyslipidemia among adults in China has remained stubbornly high. Monitoring results for cardiovascular diseases and their risk factors among Chinese residents show that for adult men in China, the prevalence of dyslipidemia is 46.1%, while for women it's 29.6%. In stark contrast to this are the extremely low rates of awareness and control at only 11.7% and 4.8%. That's not even 1 in 10. So why are blood lipid control rates so low? For one, in its early to mid stages, dyslipidemia has almost no obvious symptoms, so it's not easily detected. On the other hand, even if some people get a checkup and find their blood lipid levels are normal, they might not actually be in the clear. Let's take low-density lipoprotein cholesterol, or LDLC, as an example. For an average person who's in the low-risk group, an LDLC level below 3.4 is considered normal. But if you have high-risk factors like smoking, diabetes, obesity, high blood pressure, or chronic kidney disease, then you might be in a medium to high-risk group, and your LDLC needs to be kept below 2.6. And if you're in the very high or ultra-high risk group because you've had a heart attack or a stroke, then your level needs to be controlled below 1.8 or even 1.4 model. In other words, whether your blood lipid levels are on target needs to be determined based on your individual risk for atherosclerosis. We've also got a few charts here to help you determine if you're in a high-risk group and what your corresponding control target should be for those of you who need it. Feel free to save these for yourself or your family. So, how exactly can we control our blood lipid levels? First up, our usual weapon in the fight against the three highs is lifestyle modification. This includes adjusting your diet, getting a moderate amount of physical activity, managing your weight, and quitting smoking and alcohol. We've also taken the part about a balanced diet and made it into a chart. Feel free to grab it if you need it. When lifestyle interventions aren't enough to reach your lipid-lowering goals, then you should consider adding lipid-lowering medication. LDLC, or low-density lipoprotein cholesterol, is the primary target for lipid-lowering therapy. Recent studies also suggest that lipoprotein is also involved in the pathological and physiological process of atherosclerosis and is closely related to atherosclerosis and aortic valve calcification. Currently, the common cholesterol-lowering drugs include statins, cholesterol absorption inhibitors, PCSK9 inhibitors, Probicol, and so on. Statins, such as atorvastatin, work by competitively inhibiting the activity of the rate-limiting enzyme in your body's cholesterol synthesis. This reduces cholesterol production and at the same time upregulates the number of low-density lipoprotein receptors on the cell surface. These receptors can move the low-density lipoprotein from the blood into the cells to be broken down and metabolized. In plain English, they not only slow down the rate of cholesterol production, but also increase its recycling. However, when patients use statins, when lowering low-density lipoprotein cholesterol, after a certain point, you might find that increasing the dose doesn't lower lipids any further. In other words, even if you increased the dosage of statin drugs, your blood lipid levels may not see any more significant decreases. Patients at very high and extremely high risk often need to meet stricter LDLC control targets. This is when combination therapy is needed. For example, with cholesterol absorption inhibitors, or PCSK9 inhibitors. Cholesterol absorption inhibitors, as the name implies, work by reducing the absorption of cholesterol from food by the intestines, thereby decreasing the amount of external cholesterol entering your bloodstream. I don't really need to put this in layman's terms. It simply reduces absorption. Ezetimibe is one example. As for PCSK9 inhibitors, like the domestically developed tolecimab, they work by inhibiting PCSK9. That's a protein that binds to low-density lipoprotein receptors and causes them to break down. This reduces the degradation of LDL receptors, which increases the number of LDL receptors on the cell surface and promotes the clearance of LDLC. In layman's terms, it's like protecting your star player. The receptors don't get worn out as fast, so they can keep working consistently and effectively. In addition, Clinical trial results have also found that tolesimab can also effectively lower lipoprotein. In recent years in the field of innovative medicine, many domestic manufacturers have been making great strides. We hope to see more high-quality original drugs emerge to provide more options for clinical treatment. Of course, which specific drug to use and whether combination therapy is necessary should all be based on your doctor's advice, because even the most widely used statin drugs can sometimes cause adverse reactions. In addition, clinical trial results have also found that tolesimab can also effectively lower lipoprotein A. These mainly include liver problems and muscle complications. So you shouldn't just take them without a doctor's advice. If you feel unwell while taking them, you need to see a doctor right away. And finally, there's one last thing we want to tell you all. A heart attack isn't just some random accident that happens out of the blue. It's the accumulation of long-term habits like smoking, drinking, staying up late, and overeating. It's the health debt we build up every time we ignore our own well-being. It's a reminder that while our hearts are strong, they aren't indestructible. And while life is resilient, it's not an endless resource. But it's never too late to make a change. And for those of you with normal cholesterol levels, we want to stress again the importance of lifestyle changes. I know we sound like a broken record, but this universal prescription is really just that important. If you're sick, it can help treat your illness, and if you're healthy, it can keep you that way. It has the fewest side effects, and it's affordable too. There's no treatment in the world more cost-effective than prevention. And for those of you who already have plaque, there's no need to worry too much. As we get older, it's not uncommon for some plaque to appear in our arteries. Even if you make all the lifestyle changes we just talked about, that can only slow it down, not prevent it completely. After all, people get older, and our blood vessels age right along with us. So if you do have plaque, instead of panicking, it's better to take it seriously and manage it. And like we said, it's never too late to make a change. All right, that's everything for this video. If you found this useful, or if it helped you out in some way, be sure to follow us. That way you can learn more about medicine. If you found this useful, or if it helped you out in some way, be sure to follow us so you can learn more about medicine.